started the clinic here because as far back as 1985, 86, there was no maternity home at all in this Teshie area. The people were just patronizing the traditional birth attendants, the spiritual churches' homes, and it was appalling because the mortality rate, maternal mortality rate, was also increasing during that time. That was why I felt the need to start one here. I have 4 staff. That's the medical staff, and then 2 paramedical staff and 2 cleaners. And then the lab man comes on part-time basis. I financed the operations here purely from my pocket. I tried securing a loan from a bank where I was saving, but they told me they don't give loans to private people in private practice.
We do have quite serious challenges with financing. Obviously, healthcare, private healthcare, is very expensive to set up, and it's quite difficult to get that sort of financing to set up a business in private healthcare. The challenges are in, first of all, designing a business plan that looks attractive to the financial houses. They look at the charges we have or the fees we charge to patients, and they find the fees are low, and therefore if they work out the figures for any loans you take, it's going to take a long time to get your money back, for the banks to get their money back, and therefore it's not attractive to the banks to loan to the private healthcare sector.
The way the banks have viewed private healthcare facilities has been basically or mostly risk-based. We have the facilities that are of high risk, okay, and these are providers who are mainly one-man businesses. You have a doctor and 1 or 2 nurses, okay, and they run the business. So what happens is that you don't have in place a well-defined management structure. You don't have in place any clear-cut succession planning. You don't have in place financial bookkeeping, proper financial bookkeeping to support any request that they make to the bank.
These are people who are interested in providing a service, and they just jump into providing the service as best they can, and then later on realize that they need to keep records. They keep enough records to educate themselves, to let themselves know how the business is running and when they're running into problems and things like that. And so you have some elementary record keeping, but it's not up to the standard of what an accountant would require or what a bank would require for X number of years with the kind of discipline you need in record keeping. What we as a society are interested in is the fact that the Medical Credit Fund is going to do the management training that is so badly needed. Sometimes I think that is needed more than the financing, because you need the management training and need to understand why you do need the money. There's a lot of people who think financially they're okay, and yet when you talk to them, these are doctors, they have lots of problems in their clinics, but they don't see, they don't even see the financing as a solution to the problems that they're telling you about. And that's because they don't have the management skills, so they don't see how, the financing is going to solve that problem. They think it's not going to solve it. It might even complicate things for them.
Before, I thought that about just planning the business is just something that you put down 1 year, 2 years. That is in 2 years. This is what I'm going to do. But when I attended the training, I realized I was taught what vision is, and then goals also, and then to know my strengths, and then my weaknesses. I should know my competitors, what they provide that I don't provide, and what I have also been doing that they don't do, and how I will present my product, my services, that I will get more clients who will come here and then they will be satisfied with what I offer them. I would like to improve upon the quality of services offered here by procuring more equipment like the scan machine, and then replace old ones that I have in the lab. Like my microscope is old, the lab man is complaining that it is old. I have to get some more new equipment in place so that we can offer more services, get more drugs, and then employ more people. Because with my status now, I cannot employ more than 4 people to help.
When you go around various practices in Ghana, you will find that most of them are very small businesses. That's because that's the capacity of their financing. If they had bigger financing, then they'll be able to do bigger businesses.
The Medical Credit Fund is coming with some form of softer terms. In the first place, there's support, okay, because they are going to train, they are going to help with business plan, this thing, and they are going to even help with identification of the basic needs of the various facilities, okay.
Their credibility is unassailable. You know, they have done various projects already, and they've made a lot of impact in other countries in Africa. I think it's what we want to try and do here. You know, we want to try and be able to work with them successfully to improve practices, improve quality, improve management, improve the financing, and I have confidence that that will happen. And it's a matter of working closely together and achieving that.